Good afternoon. My name is Tatum, and I'll be your conference operator today. At this time, I'd like to welcome everyone to the CHW State Network Strategic Planning, Execution, and Impact Conference Call. All lines have been placed on mute to prevent any background noise. If you should need assistance during the call, please press star, then 0, and an operator will come back online to assist you. Thank you. Ms. Anita O., you may begin your conference.
Good afternoon, everyone, and welcome to our fourth webinar. My name is Anita, and I will be providing you with a few pointers to get you acquainted with the webinar technology. Please make sure to connect to our meeting room using the link in your confirmation email. Our panelist presentation will be displayed at the center of your screen. You may enter your questions anytime throughout the presentation using the chat box located on the left-hand side of your screen, right under the participant list. My text is in red as our dial-in information. I will now turn it over to Sergio. Thank you.
Good afternoon, everyone, and welcome to our the fourth in our series of webinars that we are holding monthly for the purposes of advancing the CHW capacity to build a national association. We'll talk about that more in a hot second. I do want to remind you that your lines, as we've just been told, your lines have been muted, and that's just for the purposes of trying to eliminate any background noise. But we do entertain questions, and so if you have a question, you will have to type it in so that we can receive it. And Gail will go through those and forward them to us. We will also, today's webinar is divided into two sections, which Jeff is going to review, but just to remind you that this is a follow-up to last month's first of a two-part series on strategic planning for community health worker associations. And so last month, Jeff is going to review last month's presentation, but that was primarily around the how and why people conduct strategic planning efforts. Today is going to be more focused on the impact, the execution, and the result or impact of a strategic plan. And the reason that we divided this into two sections is just because it's a very rich and full topic, and we didn't want to lose any of the detail and expertise of the panelists that were here last month and those that are here today. So I remind you that we will have, after each of those two sections, we will have approximately a 10 to 15 minute question and answer period. So if you have questions, please type them in for us. So now I will turn it over to Anita M. We have two Anitas here. So Anita M. will explain the role of Sanofi and why they are doing this.
Good afternoon, and thank you for joining us today. And if you have been with us before, welcome back. And if you're new, we're thrilled to have you. I just want to briefly share with you a few minutes just why Sanofi would be involved in this kind of an effort. And so on the slide, you'll see that, what we are. We're a global healthcare leader focused on patient needs. We're engaged in research, development, manufacturing, and marketing of therapeutic solutions. And you can see below there's 7 growth platforms, some of which I know are very important to the work that you do in chronic disease, such as diabetes solutions, as well as prevention with human vaccines. And you can see the other areas that we're focused on. Next slide, please. So I want to tell you, why would a company such as Sanofi be working with this workforce? And mainly it's because the mission of Sanofi, which are the 3 large bullets below, really ties in so well with this profession. And 3 of our main points in our mission are, 1, preventing disease and supporting patients, and that is really what a CHW workforce does. And we know that they can prevent disease and give much greater patient support than what's been done in the past as they become more involved with the healthcare system and prevention. We also know improving access to healthcare is what CHWs do. CHW work links the right patient with the right intervention at the right time and traditionally looks at the whole patient. And lastly, exploring boundaries of medical innovation, supporting this CHW workforce for prevention and new care models for chronic disease and prevention is what's important to us in working with you. Next slide, please. And I just have a few bullets here. I'm not going to go over all of them. You can look at them. I just wanted to share with you what Sanofi's done to date to support the CHW efforts. And just a few of them. The third bullet talks about an advisory board meeting we had last year, and it was held in November around the same time as the APHA meeting, and we wanted to have a better understanding of the impact that CHWs could have in disease prevention and access to health care. One of the big ahas from that meeting was the next bullet, which is the importance of a national organization. So we are very interested in helping to pave the way for the development of a CHW national organization. Another bullet that I wanted to point out is that we're partnering with the National Health Plan to conduct research regarding the role of the CHW in medication adherence, again, to build the value and the understanding of stakeholders of the potential of this workforce. And then lastly, we've compiled, with the help of Anita O here, an electronic portfolio of evidence supporting the strength and positive impact produced by CHW intervention. So there are just a few things that we're involved with, and of course we do help to facilitate these webinars and working with this team. So we're thrilled to continue this, and we really enjoy working with you and look forward to seeing all of you at the APHA meeting. Thank you for joining us on the journey to strengthen CHW networks. And so now I'd like to just turn it over to Sergio, but before I do that, I wanted to give a proper introduction for Sergio. And many of you already know Sergio, but I wanted just to give you his bio because it's very impressive, all the things that he's done in this space. Sergio is the co-founder and executive director of the Community Health Worker Network of New York City, a professional association of CHWs with over 700 members that works to advance the CHW workforce while preserving its integrity. The network accomplishes its mission through education, advocacy, and research. The network has established workforce standards for the CHW practice, including scope of practice and recommendations for training, credentialing, and financing. Sergio has trained and helped establish CHW programs in D.C., Washington, D.C., New Jersey, Pennsylvania, Arkansas, and New York, in addition to 8 independent nations, including the Republic of Trinidad and Tobago, the Bahamas, and 5 of the member nations of the Organization of the Eastern Caribbean States. Sergio, in the past, served as the chair of the CHW section of the American Public Health Association, during which time he worked to secure Department of Labor standard occupational classification for CHWs and helped develop the CHW Special Primary Interest Group into the section of APHA, which I know you're most familiar with. Most recently, Sergio has been working with Emerging Health Reform Innovations and DISRIP to help integrate CHWs in their interprofessional healthcare teams and continues to work to support emerging professional associations of CHWs across the country. So once again, thank you, Sergio, for moderating today's talk with us, and we'll turn it over to you.
Thank you, Anita. And I too want to extend my welcome to those of you who've been here before, and my welcome to those of you who are here for the first time. I do want to take a second to sort of place this strategic planning effort in context. About 2 years ago, Anita approached a number of us about Sanofi's interest in supporting some aspect of the CHW workforce development. And we held a meeting which some of you were in attendance at, which was an advisory group that sort of advised Anita that perhaps one of the most important aspects that they could support would be the development of a national association of community health workers. As many of you know, there are really only 2 other venues that we have at which CHWs come together nationally as a national workforce, and those are the Unity Conference and the APHA Conference. And neither one of those are independent professional efforts. Clearly, in the most recent interactions with APHA, it has become clear to us that we are not at total freedom to describe ourselves or our practice, but that we are part of a larger parent organization that has bylaws that we must obey if we choose to belong to that. And so it has become increasingly important for us to have our own independent professional association that we can use as a platform for advocacy and regulation of our own workforce, and live in accordance with our core principles and with our core values and guiding principles of self-determination. And so this whole effort is really gaining more and more significance and importance as the interest in our workforce grows and explodes, in fact. So we had a series, we had a seminar last month that looked at sort of the how and the why of strategic planning. And there were a number of panelists that contributed to that. And now this is the second part of that series where we shall consider more what is the execution? How do you actually do? Not so much the how and why, although Jeff will certainly review those, but more the how do you do this and why do you do this? What is the result of having done this? I can tell you personally from having gone through strategic planning efforts a number of times for my organization that it is our anchor. It is the single most powerful tool that we have to keep us anchored and focused on why we exist. And it doesn't matter what storm we weather, it really serves us to keep us focused on our purpose. This is very exciting for me. I will tell you one last thing, and this is something experiential and really important. I notice in my efforts to help other fledgling and developing organizations of CHWs across the country that a lot of organizations get together for the purpose of creating a vision or a mission or to do some strategic planning. And I find most often that those efforts fail. Those efforts to organize for the purpose of developing a strategic plan fail because the strategic plan is not easy work. It's arduous. It's hard. It's introspective. It requires really a lot of energy and commitment. And so if people are gathering just to do this hard work, it generally doesn't result. It doesn't yield success. It generally is better if your group has a purpose, if there's a pre-existing dynamic to the group, if there's sort of an essence that your group exists for, if there's a camaraderie, if there's a reason for being. In fact, if there is a group, that it's important that exists before one tackle something like a strategic plan. It's very difficult if people don't have a group dynamic to come up with a vision if there's no reason for the group to exist. And so I would just caution that this is not necessary, and we tried to do this last month, but we really want to hammer this home. A strategic planning initiative is probably not the very first thing you want to do. You might want to have some donuts and coffee first, and build up the camaraderie in your group before you tackle such a challenging enterprise. But once you do tackle the strategic planning effort, it will be priceless for you and your organization. And so, having said that, please allow me to introduce our esteemed panel. We're really lucky this month. We have three panelists that will contribute to the discussion this afternoon. So please help me welcome Paola Gutierrez. Paola Gutierrez is the Director of Program and Training for South Carolina Pasos. Paola is a native of Greenville, South Carolina, born to Colombian immigrant parents. Paola started working with the Latino community in 2005 in Charlotte, North Carolina, addressing the needs of domestic violence survivors. And since then, she has continued to work for nonprofit agencies in South Carolina, focusing on the needs of Latinos and others with limited English proficiency. She is now the Director of Programs and Training for Pasos, where she trains CHWs for this community-based organization. Paola is a member of the leadership team of the South Carolina Community Health Worker Association. Joining Paola, we have our dear friend Katie Mitchell. Katie Mitchell is the Project Director of the Michigan Community Health Worker Alliance. Katie is MCHWA, the Michigan Community Health Worker Alliance, is a partner-driven coalition whose mission is to Michigan's health and human service systems. She has worked with MCHWA since its launch in August of 2011, supporting the partnership by engaging CHWs and their stakeholders statewide as its sole full-time staff person. Katie oversees MCHWA's activities, including its steering committee, working groups, and statewide initiatives related to CHW policy, financing, appreciation, and workforce development. Katie also speaks frequently on the CHW workforce at the local, state, and national levels. And lastly, please help me welcome Jeff Wilkinson. Jeff is a clinical professor at Boston University School of Social Work. Jeff has worked for many years very closely, actually, with MACHWA, the Massachusetts Association of Community Health Workers, for the past 13 years on policy advocacy, workforce development, and organizational development issues. He became a CHW ally when he was the executive director of the Massachusetts Public Health Association, the state's APHA affiliate, and then provided senior management support for CHWs at the Massachusetts Department of Public Health, where he worked for 7 years on the commissioner's staff. He served as the founding chair of the Massachusetts Board of Certification of Community Health Workers and continues to support CHWs now as clinical associate professor at Boston University School of Social Work, where he teaches community organizing and management. He also teaches health politics and policy for the Boston University School of Public Health. So please welcome our esteemed panelists, and I will first ask Jeff if he would please do an overview of the presentation from last month, which was on strategic planning, how and why.
Thank you very much, Sergio, and good afternoon, everybody. Anita's great introduction of Sergio did not include something I think that folks would be glad to know, and that he's the author of a great book called Bridging the Gap, published by Oxford University Press and available on Amazon, and I'm hereby giving it a plug. If you haven't read it, it's a great resource. Next slide, please. My task right now is to summarize 90 minutes of the webinar we had on September 16th in 5 or 6 minutes now. So Anita is going to turn up the speed, and through the miracle of technology, you're going to hear 90 minutes worth in just 6. We were joined on September 16th by Dana Ray Feist from Louisiana and Ashley Wennerstrom from Louisiana, as well as Paola, who's back with us. And we started by defining strategic planning as a disciplined effort that produces fundamental decisions and actions to guide what an organization is, who it serves, what it does, and why it does it. That's a lot. And as Sergio said, you have to have an organization to warrant going through that process. The focus is on the future, looking ahead at what's important to the organization and how to achieve it. And it includes measures for success so that you can have benchmarks and know that you are achieving what you set out in the strategic plan as a priority. Next slide. So we envision this, and we've been presenting this as basically a 3-part process. And last month, in September, we looked at the development of a strategic plan, and the panelists addressed 3 questions. Today, we are going to be looking at the execution and impact of strategic plans, or the 2 other bullets and the related questions there. So I'm just going to speak very briefly and give you an overview if you missed that last webinar. By origins of the strategic plan, the panelists address questions about why do you do a strategic plan? What would be the anticipated benefits? And as you imagine, they include a lot of different things for different states, but in both Louisiana and South Carolina, people were interested in expanding the active constituency of their CHW associations, doing leadership development, capacity development, strengthening their finances, taking on policy and programs. So there's a lot of good reasons to do strategic planning, because all those kinds of activities are hard. They also addressed how to decide whether to do a strategic plan. Who makes that decision? And this varies depending on the stage of organizational development. But our panelists last month described processes in which typically they're board members or advisory committee members, and if they had an executive director, that person kind of had key roles in thinking about this. I would say that regardless of the organization, the decision to do strategic planning is taken on by people who are most committed to and involved with the organization. There's a lot of opportunities to involve outsiders, but the core group are folks who've already really embraced the importance of that organization. Next slide, please. So we also looked at roles and resources. Who facilitates the process. And that can be members of the board or the staff, but you can also have outside allies or consultants, if you can afford to do it, to help actually plan the strategic planning process and walk you through it. Typically, board members and staff participate, but also there are opportunities to engage your members at large, partners, stakeholders who care about the organization. There was some discussion about how to engage community health workers, and our panelists acknowledge that that is sometimes both one of the most important strategic goals of a planning process and one of the most important challenges, because CHWs are typically working and may not have support from their organizations to do it. It takes a lot of time to do strategic planning, community organizing too. And as Sergio said, you really need to be able to put the time in to get good results out. There are a lot of meetings, a lot of phone calls, and research that's involved in helping to know where the organization stands, what its options are, and how to best capitalize on opportunities. We also talked about resources that are needed in strategic planning, and those vary. But you need space, you need food, you may need administrative support, maybe you pay for facilitation, maybe not. And folks also talked about what promotes and restricts the process. And basically it's the talents and the passions of the members and the resources that people committed even from outside the organization can bring. But time constraints and lack of resources, and sometimes just the inertia of what you're currently doing, can provide practical constraints. And we're going to be talking more about that today. Next slide, please. In terms of the elements of a strategic plan, we talked about mission and vision, goals and objectives, strategies, the time of a strategic plan covers, and metrics and measures. I wanted to add today that we talked a little bit in September about research, but that's also a very important part of a strategic plan. And we're going to talk a little bit more about that today. Next slide. Next slide, please. So a mission is really the reason the organization exists, what it hopes to achieve. The vision is the dream or imagined future state in broad terms. But you go through a process of kind of winnowing down from your vision and mission to more specific goals and objectives. What does the organization want to accomplish in the planning time frame that it sets? That's the core framework for a strategic plan. And then what specific results do you expect? And we distinguish between outcome and process objectives. And we talked about so-called SMART objectives, making objectives defined carefully so that they're measurable, they're achievable, they have some time attached to them so that you can know whether you're succeeding. Research, including a so-called SWOT analysis, came up in the discussion. And so we'll talk about that just very briefly. Next slide. But we also talked in terms of basic elements about how to achieve your strategies by picking your objectives by picking strategies. We're going to get into more detail about this, but that's kind of the heart of a strategic plan. What's the roadmap? How are you going to get from where you are to where you want to go? The time frame for strategic plans varies. One of our panelists described an annual update in their strategic planning. Another panelist was figuring that out. A lot of CHW associations want to look at 1 to 3 years probably, because it's very hard to anticipate future events. But you can look farther out, and large corporations are looking out 10, 15, 20 years. And we're going to talk a lot today about metrics and measures, how to set objectives that provide the basis for evaluation throughout the implementation of your plan. And last slide. So a SWOT is an acronym for strengths, weakness, opportunities, and threats. And if you look internally at your organization, what are your strengths? What do you have at your disposal, both in terms of resources, experience, organizational culture, relations, that help you to achieve what you want to set out to do in your strategic plan? And then conversely, what is holding you back? internal to your organization? What capacities don't you have? What leadership challenges may you face? What resources do you need? So having a good handle on that in the research phase becomes very important in thinking about strategy. And we also have to look outside of our organizations at what the opportunities are. And for instance, now with healthcare reform and the emphasis of how important CHWs are for achieving the triple aim, there are a lot of opportunities in the policy environment. But you can look at opportunities close to home. Who are the employers? What kind of legislative support? What kind of funding support might you get? But also the threats that are going to hold your organization back in the external environment. So we want to look at all of that and have a good handle on that before setting strategies, because that SWOT analysis helps define the context and the real-world conditions in which your strategic plan takes shape. So there you have it. That's basically what we covered last time, and we're going to move on now and look more specifically at execution of a strategic plan. Thank you.
Thank you, Jeff. That was an extraordinary summary of last month. And for those of you who are on the call, this webinar is recorded, so you don't have to memorize every word Jeff just gave you. You will be able to review it at your convenience. So let's move right into the first part of today's session, which is the execution of the plan, and in particular, the processes involved in communicating that plan. And the first question I would ask is how and with whom did you communicate that plan? And I would address Katie Mitchell first, please.
Great. Good afternoon. Thanks, Sergio. So with MISHWA, we do our strategic planning as a group. And so the big things in terms of communicating the plan is to make sure that we are including everyone who is a part of the process of development in the communication, both internally and externally, once the plan is complete. And so for us, development is a process among a very large group of stakeholders. The way that our structure works is that we have a steering committee, but we also have 5 working groups, including an evaluation board. And we also actively seek feedback on the things that we're doing over the course of a year from our general participants, including those who are a part of those different groups. And we really also want to consider those external and internal forces and figure out how we're communicating with them to make sure that that voice is also included as a part of this process. Next slide. When our plan is finalized, we take it and we communicate it right back to the stakeholders who were directly involved in its creation. And so it's not something that's kept in a locked box amongst our steering committee members only. It's something that we make sure everyone has access to, and that anyone who could have ever touched it has the ability to know what's in it, as well as how we're going to go about achieving what we have set out to achieve. We really need to make sure that transparency is maintained, and we really need to always make sure that we're communicating what we're doing back to the people who you want engaged in doing the work. And as a coalition made up of entirely volunteers and people who are donating their time either on behalf of their agency or on behalf of themselves, we want to make sure that they know that all of their efforts are part of this larger vision and plan that we have. Next slide, please. And so with that, we really do have a focus on transparency, and we communicate our plan back to our stakeholders through our newsletter, our website. We include it on some of our overview documents that we send out to different stakeholder groups and agencies. And we also frequently will include it in applications to funders, in different testimony that we may provide, and make sure that all of our organizational partners are also a part of this. We do caution, we want to be wary of oversharing, and so there's some details, which we'll talk about a little bit later, where you don't need to share every single step that you do all the time. Not only can that be an administrative burden, but not everyone needs to know that you have a meeting next week with one person that could be a part of checking an activity off a very long list on your plan. But there can be a lot of opportunities when you do share. And so, for example, we shared kind of what we were focusing on for this year as a part of an end-of-the-year newsletter last year. And within 2 weeks, we had several people who kind of came out of the woodwork inquiring about how they could get involved in participating in that, because it aligned with their plans as well for the next year. And so communicating externally as well as internally can have a really great outcome in terms of engaging additional partners, making sure that CHWs see opportunities for themselves to participate, and making sure that people know what's going on and we can all be on the same page together.
Thank you, Katie. Those are all excellent points. Thank you so much. Paola, I wonder if I can address the same question to you. How and with whom did you communicate the plan?
Absolutely, and a lot of these things are similar to what Katie was saying. We did start very small, and it was with the advisory council. And in part of the advisory council, we did have CHWs that were part of the process. And I'm going backwards. So how was through in-person meetings. We definitely wanted to avoid phone conversations, and we wanted everyone to be present in the room. And I just thought of what Sergio said in the beginning, getting the coffee and the donuts out to make sure that everyone is together on the same page and happy, and to take on this big role and this big project and go forward with it. So there was the advisory council, and then it was spreading out to different team members of staff and CHWs. Well, CHWs are part of the staff. We have different levels. As I had mentioned in our previous webinar, we have volunteers, and we also have CHWs that are paid staff. And then different partners because we have 6 different sites statewide. So we would let our partners know what the strategic plans are. In addition to that, our host sites, and we would also put some of the parts of the strategic plan, which were the mission statement, values, and model, on our website. We did want to be transparent, but imagine if you put your whole strategic plan on the website, it might be overwhelming. But we do definitely provide the strategic plan to those who are interested in seeing it. And it has led to wonderful outcomes for sustainability when we were sharing with partners our strategic plan. One of the examples is with Greenville Health System. They were a great partner, and in seeing the progress and the direction we're going to, last year they agreed to sustain pastos 100% for 2 of our positions. Next slide.
Well, so thank you, Paola, and congratulations on that source of funding and support. Jeff, I wonder if I can ask you to chime in on this. How and why, how and with whom did you communicate the plan?
You bet. I'm just going to be kind of a cleanup hitter here, because I think that both Katie and Paola have hit the key points about who you want to communicate a plan to and why, and they've given some practical examples. I just want to pick out a couple of points. One, that Paola was just saying, putting the whole plan on your website may be a little bit much. Katie warned about oversharing. And one thing that we've done with strategic plans is to publish a summary, an executive summary. And that's a way for you to communicate to different constituencies what the important parts of your plan are without getting into all the exquisite detail that you may want internally. Another thing I would just highlight is that when you use the plan with outside stakeholders, a strategic plan can be very attractive to funders and can be a very powerful tool for presenting proposals and having discussions with funders. Sometimes funders will even support a strategic planning process if they believe in what you're doing, but they will typically be impressed that you did it. They'll want to look at it, and you can really use that. Next slide. I would just say that as you think about all the different steps in a strategic planning process, and the 3 in green are the ones that correspond to that chart I talked about a few minutes ago. But even before you start developing a plan, somebody has to think about the concept of doing it. You have to reach consensus among your partners that you want to do it. You've got to figure out when to do it. You've got to recruit other people to do it, all before you get into the official part of the plan, and that all takes communication. So you want to be communicating through all the steps. I think the bottom line is that CHW associations are formed to empower CHWs, and information is power. So if you are sharing this information about your process and its outcome through the strategic plan, you're building ownership of your association, you're building buy-in, you're increasing CHW power, and that ultimately strengthens your organization.
Thank you so much, Jeff. This is really turning out to be extraordinary. So I wonder if we could move on to the second question in this group, which has to do with prioritizing from many possible objectives. And so I wonder if I might ask Paola to contribute first. How did you choose priorities from the many possible objectives and strategies that emerged during this strategic planning process?
Absolutely. So everything we found was very important as far as prioritizing, and it was more about who was the lead of each objective in terms of what time did they have and funding. There were a lot of emerging strategies, funding and results of SWOT analysis, as Jeff was talking about earlier, opportunities, and what was the evaluation showing. For instance, high in education but low in partnership success was something that we were looking at. We were seeing that our education was a strong point for us, but then we weren't having a lot of partnership opportunities, and so then we changed a little bit our strategy. And our grants and evaluation director took these evaluations and she translated them into measures to reach objectives. There's definitely been a journey because our reports in the beginning were Excel spreadsheets with a couple of columns that each CHW submitted. And then just 3 years ago, we started using a database which we call Apricot. And that has been just an amazing tool for us to use to look at our objective leads and to also look at the partnerships that have led to funding. And these findings, we just evaluate constantly to see how we can improve them. Next slide.
So thank you, Paola. Katie, I wonder if I can ask you to address the same issue. How did you choose your priorities from the many possible objectives and strategies that emerged during your process?
Absolutely. So this really can be the hardest part. How do you choose once you have all these big ideas? There are so many different options and so many different opportunities, and after doing a SWOT analysis, you can see a lot of those. And so for us, what we've done is that we've really gone back to kind of our core, our vision and mission, which Jeff was talking about earlier. So thinking about, we have 5 long-term vision statements, and so really considering, do these things fit under that vision? And then we also have our mission as well as some long-term goals, and do these different objectives and strategies fit under those right now? We also ask ourselves some questions to help identify priorities, and those include things like, does this fit? Do we have resources to act on a particular priority? And when we think about resources, that includes time, personnel, funding. And then one big question that sometimes we forget to ask, but is really, really valuable to ask, is what would we not be doing if we did this? In economics, we might refer to that as something called an opportunity cost. And so is there something else that we couldn't do if we did this instead? And when you think about limited resources, that's often something that comes up. Next slide. And so for us, with our process, we engage in a host of strategic planning activities, and we tend to try to identify priorities by working in small groups, and we will do this both in person and over the phone, because as a state, we are geographically a little bit larger, and it's very difficult to get people in person all the time. And because we've been doing this yearly planning process now for 4 years, we do review our previous year's work and previous efforts to understand what has or has not happened in order to also identify priorities. And so we don't want to keep something around if we are not making progress and we've identified factors that might not be something that we can move forward on. But we do want to make sure that if something hasn't been accomplished, that we continue to identify ways to do that if it's appropriate. And we also prioritize objectives by really pulling from the people who are on the ground doing the work. And so our steering committee identifies some larger areas for focus, but our working groups really hone those objectives and priorities, send them back to our steering committee, who then finalizes our full plan. And so we use a very participatory approach to help prioritize what our groups and what our CHWs and stakeholders on the ground really want to focus on in a given year.
Thank you, Katie. Very practical recommendations. Thank you. And Jeff, can I ask you to address this issue of selecting priorities, please?
You bet. It's really a two-part question because you've got to prioritize objectives, and then once you've done that, you have to prioritize the strategies that you'll use to achieve those different objectives. But the objectives are the starting place because that's what you want to achieve. So as you think about that, and I like to, Katie, talking about small group work and some of the practical processes they use. I'll insert that there are a lot of group process techniques that can be used in strategic planning. You don't have to reinvent the wheel. In this webinar series, we're kind of giving an overview, but there are a lot of people you can talk with about various specific techniques to get a lot of information and ideas out of a relatively small group of people in a concise amount of time. It's not unusual when you go through that, however you do it, to have a room full of butcher block paper plastered all over the walls with all sorts of great ideas. And you literally have to figure out what are you going to choose, because you can't do everything. So I think some key questions you've just heard from Katie and Paola: what's most important, how much time do you have available, and what is important to get done in the short term, mid-term, and long term, so that helps you focus on what do we have to do first, and what resources do you have, or what resources are available. And I love Katie's question about what would we not be doing as well. Next slide. Once you, and as I say, there are techniques that you can use that are pretty cool and fun for a group to use to help get a sense of the group about which objectives may be most important. Once you've prioritized those and you're looking at strategies, there's a technique called force field analysis that sounds a lot fancier than it really is, but it's just a tool to help you assess the strategies that you come up with to achieve your objectives, and to think what is working in favor of achieving it and what is working against us. What are the driving forces and the restraining forces? And how can we strengthen the driving forces? How can we weaken or neutralize the restraining forces to make sure our strategy is viable? If you can go through that, actually write it down on a chart. But if you do that process and find that, wow, this doesn't look realistic, well, that's helpful to know, and you maybe want to choose a different strategy.
Thank you so much, Jeff. So please allow me to move into the third question in this grouping here, and that has to do with the use of your strategic plan. So, Katie, I wonder if I can address you first, please. But how number one is how did you translate your strategic plan into action, and secondarily, organizations typically find change to be hard to do. So how did you change what you were doing on a practical basis as a result of having the strategic plan developed?
So with translating plans into actions, the way that we structure our planning is that we have an overall goal. So the example on the screen is from our CHW network, which is one of our working groups. It's our CHW-led and facilitated exclusively group that's focused on CHW leadership and support. But we have the overall goal, which is listed as grow and strengthen a vibrant network of diverse CHWs and CHW supporters. And then we have a series of objectives, and then within the working group, they determine their activities for the particular year. And so this is something straight from our plan for the network this year, which they have 6 objectives on the year, and the 5th one listed there talks about gathering CHWs in person at least 4 times before the end of the year. And so with the group, they've gone through and actually brainstormed how would we actually do that. So how would we translate this idea into an action? And they came up with 6 different ideas, which are then listed under the activity section. Next slide. And so when we have those, we then take those activities and have to kind of wrestle with, well, what does it really look like to do these? So we've identified that this objective is something that we can accomplish, that we think is reasonable to do in this period of time. We make sure that all of our objectives are SMART, which Jeff previously talked about, making sure that your objectives are specific, measurable, achievable, relevant, and timed. And so we think our objective is reasonable, but then what activities are reasonable to go along with it to really make sure that it happens? And so our CHW Network Working Group, they meet monthly via conference call, and during those calls work on their objectives and identify different things that they can do to assist in meeting them. I meet with our CHW Network leaders at least monthly to review everything, and at least quarterly we kind of go through our plan for the year and identify where we're at. And we can assess the value of activities as we go. And so we may plan to have, something like an after-work, potluck or dinner But if it turns out that planning is too difficult, we might abandon that idea and insert something else instead, because as long as we meet our objective, we can shift our activities and actions as we need to. And that's something that's really key in terms of translating success, is that you're going to have actions that might seem like a great idea to start, but there could be unforeseen circumstances that make it something that you can't implement instead. And so we always want to make sure that we can change things around to still meet the objective and meet that part of the plan, but also make sure our activities are reflecting what environment we're in. Next slide. And so one of the big challenges with translation is to make sure that people are kept in the loop and up to speed. And so if your activities are shifting because of other forces, you want to make sure that you're communicating that back. And again, we think about questions to ask ourselves as well. And so we always want to ask, why are we taking this action at this time? So it may not be a great time to have an after-work social if it happens to be during, a holiday period or during, a summer break where a lot of kids are off school and people are reporting that they can't get away because they don't have, consistent childcare or something like that. So you always want to say, oh, maybe this is a good idea, but maybe not at this time. Still within our time period, but maybe not right now. And think about what alternatives exist, what factors are impacting our decision-making. So are there other things happening where the group feels that we need to take a certain action at a certain time? And then again, what resources need to be considered in taking the action on our larger objective? And we do find that our actions do typically adjust depending on resources, which is always something to consider.
Thank you, Katie. And Paola, I wonder if I can ask you the same question, the same two questions.
Absolutely. Sorry, I lost you guys for a second.
So how did you translate your strategic plan into action?
Absolutely.
And then, go ahead.
So at PASOS, we have one statewide strategic plan, and then we have 6 different site plans. And we have two retreats each year where we take 2 to 3 days, and we talk about strategic planning and a lot of different other topics that strengthen our staff. And with that one strategic plan, it's a big statewide summary of objectives that we have and how we're going to achieve them. And then, but through breaking them up into 6 different sites, we can see and visualize and plan for specifics. And each site can have a neat, tangible idea of how we're going to achieve these strategies. And as you were saying, translating the strategies into action. We're doing this because it's the right thing to do and it's what the community wants. We do have these strategies, but sometimes they change because we're listening constantly to what the community needs and to what it wants. As a lot of you might know, it doesn't work if you prescribe medicine, if you will, to a population. That doesn't work because if you're not listening, then it's not going to work. And we're very attentive to what the community wants. Number 2, organizations typically find change hard. So how did you change what you were doing on a practical basis? We started out we were known as perinatal awareness for successful outcomes, as that was our focus. And now we're known as PASOS, known as Steps in Spanish. Our advisory board suggested that we use a different name because we had outgrown that specific focus where we are now today. We started out with a workshop that was 4 classes targeting prenatal care. But based on listening to the community, as we were saying what the community wants, we expanded to 12 different topics. And that was a challenge for our staff and our CHWs because they were used to one specific topic, and they had to get trained and learn more about different topics, from prenatal care to sexually transmitted infections, to domestic violence, to knowing your rights and responsibilities, nutrition and fitness, great resources for childhood development, stress for mothers. We looked at and also how to be a great dad. So, and those are just a couple of them. So they went from one specific, and they were experts in this, but based on what the community needed, they we received more training, we received other resources, where now we have these different topics, but we've adapted to these changes through we made videos. Each different workshop had a video. We reenacted what the workshop would look like, and whoever was new would have this resource to look at the video so they could know more or less what they could expect and then keep doing it on their own. And also it was very helpful to continue with these challenges, keeping in mind what our values were: equity, education, family, community involvement, excellence, and trust. And as you can see, community desire and funding sources. So some of our programs also were altered a little bit based on the funding source that was appropriate for us as well. Next slide.
So thank you, Paola. Thank you so much. And Jeff, I wonder if I can ask you to contribute to that, the discussion of those two areas.
You bet. This is such an important question. I think doing a strategic plan is like going to a great conference and then coming back to work after the conference is over and thinking, oh my God, how do I do all those great things that I just learned about and want to do differently? Because you're already busy doing great work. Or going on a vacation and coming home thinking about how you want to change your life, but your life is your life. So you've heard from Katie and Paola some practical steps of translating strategy into action. I just want to emphasize that regardless of how you do it, you really have to follow the old adage, plan your work and work your plan. Write it down. There are a lot of different ways to plan work. If you want to go to the Google Gantt, G-A-N-T-T, or PERT, P-E-R-T, two different kinds of charts, and they can get very sophisticated. You can just take the core essence, but it's basically a way to figure out what are we trying to do, when are we trying to do it, who's responsible to do it. And you can plot it out so that it appears on a page and you can see the relationship of one task to another over time. But no matter how you do it, you can start simply. You don't have to get too fancy. You can use Excel. You can use paper and pen. But write it down because, as Sergio said at the very beginning of the call, this plan is a tool. It's something that you use. It's something you refer back to. And if you don't have it written down practically, there's nothing to refer to. Next slide. Ultimately, you can't get away from the requirements of time management in making those tough decisions about how do we do things differently. You're not going to get back from the conference. You're not going to come back from vacation. You're not going to finish your strategic plan and be able to transform everything overnight. You have to kind of figure in what are we letting go of, what are we changing, and how do we use the time we've got most effectively. Again, you can go to the web if you're not familiar with time management basics and find a ton of information. It's a big business, it's an industry, but the basics come down to some pretty simple things. Know what you want to accomplish. Understand how you're using your time now so that you can make some decisions about how to use it differently. Focus first on what's important, not just what's the fire in front of you, but what's most important to get done to achieve your plan. Think about the time wasters. You know, we're all multitasking, but there's a whole literature out there. I won't bother to get into the details, but there are lots of very useful lists about how we often waste time. And you can reclaim some of your day and make time to do some new things. And ultimately, we have to manage our stress. CHWs, by definition, are stressed. People running associations are doing it often as volunteers, and this is one more thing. That actually is an impediment for a lot of CHW associations. So don't forget self-care. We have to sleep. We have to eat. We can't do everything. So pay attention to those basics because it actually is very important in terms of practically implementing your strategic plan. And when you have some success, celebrate it.
Yeah, thank you so much, Jeff. I'm going to use my ability as a moderator here to, I'm going to forego the question and answer period because of our time constraints, but I do want to take a moment to appreciate the extraordinary rigor and vigilance that you folks, that you panelists, have contributed to this experience, and your commitment to this process is really extraordinary. I really appreciate both the practical considerations and the theoretical processes that you're taking us through. And I do want to say that, some of this stuff around like force field analyses, SWOT analyses, SMART considerations, they're not just sexy acronyms. They're really powerful tools. And it is really so rewarding to me to hear you put these tools into action. So I'm going to progress into the second part of the seminar today, which has to do with the impact of a strategic plan. And I'm going to ask the first question of Paola first, and that is, how did you define and measure success? And secondarily, what impact did you find that your strategic plan had on your expected results?
Mm-hmm. Any outcome that we received for us was a success. Even if it was something that we really didn't want to see, we thought, that didn't work. But that means we didn't do something right. And I can think of in my first days with Pasos, and I hate to say that I didn't have it completely ingrained in me as many great CHWs that you have to really be attentive to everything that the community needs, me specifically. And so I can very clearly recall one of my first workshops, and I had food, I had a great venue, I had everything, and nobody showed up. And all these people said, yes, I'm going to go, and then nobody came. Maybe one person, and maybe that was a volunteer. And I was so upset, and I was like, why don't they come? They have everything. But when I sat down, I thought, okay, this is an opportunity. I'm doing something completely wrong. This is an opportunity for me to go back and ask and say, hey, why weren't you able to come? And that's where I started figuring out it's not a good time of day, it's not a good this. And that was an opportunity for the next workshop to be successful. CHWs and referrals to us, we have had many participants of our workshops and our outreach events that have become CHWs, and that is a success for us. For someone to say, I really like this concept, I really like helping people, I love this piece of education that is culturally appropriate for me and my family, and I want to do the same thing. I want to be proud of myself, my community, and for my family to be proud of me and my endeavors. So that's one of our measures of success. And also the referrals that we receive from people, from partners, from other agencies. And also another measure of success is 85% of the people that come to us, they're word of mouth. That is amazing. How did you hear about Pasos? Oh, somebody told us about it. Or my neighbor, mi comadre, somebody told me about Pasos, and that's why they're here with us in this classroom, in this venue, in this health fair, whatever it may be. And quality for us is success. Quality is the measure of success. And there's a small image at the bottom of the screen and of the slide, and it's on our website, scpasos.org. And if you go to About Us and Success Stories, you'll see a couple of different stories. And I chose to show Norma. She is a community health worker of ours, and her story is just beautiful. And there's also a video that's very touching. And so it's these stories, this qualitative data and these stories of people who want to become leaders, that is our number one, I have to say, measure of success for Pasos. Next slide. And how were these efforts channeled?
That's a repeat of your previous?
No. What's the question?
The question is, what impact did your strategic plan have on your expected results?
Sorry. Okay. Yeah, I got lost. Yes. So the different strategic plans, they help channel our efforts, and we were over or underestimating. And for instance, in 2015, our strategic goal read at least 50% of participants who selected a measurable behavioral change goal as a result of attendance in educating in an educational session would attain their goal. So we started out with 50% of people attending the workshop would have a behavioral modification, it's also called. And in reviewing this goal that we had in 2014, we saw that we were perhaps adding too many behavior goals or modifications, and the participants were adhering to very few, with little discussion with their CHW who was conducting the workshop. So in 2005, we added a new initiative which consisted of home visits focusing on breastfeeding and oral health. These visits had a bigger impact on participants adhering to behavioral goals or modifications. So our 2015 strategic goal added that at least 75% of participants in the home visits would achieve a measurable behavioral change. So there is a difference. So before it was 50% for a different activity, but because of the impact of that one-on-one conversation, we had a higher rate of participants that they felt would change or modify their behaviors. And as far as the previous educational goal, we kept it, but we reduced the behavioral goals and asked them to just pick one of them.
Thank you very much, Paula. Katie, I wonder if I can ask you to address those two issues. How did you define and measure success, and what was the impact on your expected results?
Great. So within MISHWA, we work under a process and outcome evaluation model. And so we're looking at, are our processes successful, as well as do we have defined outcomes that we can measure to show our success. And so when we think about our larger strategic plan, our objectives fit under either the process or outcome bucket, which means that we're looking at different measures. We're looking at different ways that impact is happening. And how we define and measure will change depending on if it's a process or an outcome we're looking at. And we have an evaluation plan in place to assess that. And so similar to what Jeff was talking about in terms of writing it down, whenever we create a plan and whenever we do our strategic planning yearly, we also create a coordinating evaluation plan that kind of walks through what we're actually going to do to track and measure how all of this is working so that we can adjust as needed. And the diagram on the right kind of shows our process for all of this, is that we have our engagement and logic modeling. So a logic model is another tool that can be used. And we do our planning, our collection and management, which it's not necessarily going out and collecting pieces of data, but data shows up in a lot of things, including meetings that happened and meeting minutes and events and things like that. We analyze it, we take a look at it, and then we also report out on it and then give all of those results back to our different groups so that they can be informed, respond to them, and then consider our impact or how our impact could change in the next cycle based on those results. Next slide. And a big part of it is that we design our plan with SMART objectives. And so the M in SMART is measurable, and the T is timely. And so there's always something that we can measure. And our success does vary year by year in how we do this. And we've gotten better at writing our objectives so that it is something that we can measure so that we can really assess our impact. And part of it is the need to build in that flexibility so that we can make sure that we're adjusting to what's happening in the larger context around us. So, for example, I've got two different objectives from our policy and finance working group. And in 2012, this was the first time that we did a strategic plan, and we wrote something about developing a legislative agenda. And it was defined, we had a timeline on it and everything. And it turned out through the course of that year that we figured out that legislation was not the direction we wanted to go at all. And because we wrote this objective in such a way where it was we either develop it or we don't develop it. So if we develop it, we've met it. If we don't, we haven't. It didn't leave really room to tell the story about why we chose not to do it. And so we didn't write something about assessing the value and implementing. Instead, it was developed. And so that particular objective in our report was listed as, it was done. It was listed as incomplete but terminated permanently because we were not going to be developing legislation and chose to not pursue that again in 2013. So future objectives, like one from last year, includes language about things like monitoring and seeking opportunities to collaborate with partners. And then our activities get into what those different opportunities could be. But we can count those different opportunities and we can build in activities about monitoring, whether it's getting updates from partners on phone calls, checking in with people, having our different work group members report out on projects that they're doing. But we've learned to be a little bit flexible with our objectives so that we make sure that we are really assessing impact and telling the entire story about what happened, and not limiting ourselves to only telling one half of the story.
Awesome. Thank you so much, Katie. Jeff, can you add your wisdom on this?
I'll try, because I think it's is a little tough, because I think both Paola and Katie have done a great job of giving specific examples of how you translate what you want to do into specific measures. Each of the 5 boxes on that chart that Katie just laid out 2 slides ago is the subject of multiple books, courses, PhDs, industries. Every one of those boxes is its own industry. This stuff can be very complex. So at the risk of sounding like a philosopher, I just want folks to step back, don't be overwhelmed, and remember that all this is really about is to help you think about what does your association want to do and need to do in a certain time frame to move you ahead in ways that your constituents feel are important. When Katie talked about process and outcome objectives, the process is the way you do something, the outcome is what you hope. If you're trying to affect diabetes levels, there's a lot of process, home visiting, flyers, educational programs, that's all process. The outcome that you're looking for is, do the AC1 levels change? Are people healthier? So you can measure either. They're both legitimate. But we want to keep our eyes on what it is that we're trying to accomplish. And the evaluation measures are linked to our objectives. So if we're smart about how we set up our objectives, how we conceive whatever it is that you want to do, then you've got the basis for measuring it and evaluating it. And formative and summative, fancy words, all it means is evaluation doesn't happen at the end. It happens all the way through if you're doing it right. So you can have a summative evaluation at the end, but in order to have success, you want to be looking all the way along at how are we doing? What are our benchmarks? Next slide. There's a paradox in setting up smart objectives, because you say whatever gets measured gets done. And again, whole industries around helping organizations to measure what's important. But it's also said, and I think this is particularly important for CHW work, not everything that counts can be counted. So again, step back. I love the kind of the qualitative description that Paola gave of how they define success in terms of the stories, the human impact that happens with some of their CHWs. That's bottom line. That may be process, but that's outcome too. That's empowerment. So we want to balance both approaches.
Thank you, Jeff. Thank you so much. And then if I may ask the last question for this series, and that has to do more with how do you, sort of tracking. So how did you evaluate the progress and ensure that you were moving forward? And there are a number of bullets that the panelists can choose to address this from different perspectives. But I'll ask Katie to contribute first. How did you evaluate progress as you were moving forward?
So we do a lot of evaluation, and evaluation is very much ongoing. And a lot of our evaluation resources are available on our website. And we do a lot of engagement, both with our staff and students, as well as all of our committee members, our steering committee, our working groups, to really identify different ways that we can measure our progress. We implement surveys, we review meeting minutes and other documents. We identify activities that met our objectives, so different events, different groups of people getting together, even phone calls. So even among our CHW network, for example, they'll frequently report, oh, I connected with all these different people about, this upcoming event, or, oh, we shared a bunch of resources and it was because of this, this, and this. And that's part of the story that needs to be told. And it can be very difficult to count that, but gathering all of that evidence and all of that information is very helpful. Our steering committee reviews all of our work as compared to our long-term vision. And we do publish our evaluation report at the end of each year. Our Evaluation Advisory Board oversees the process, which is a participatory board made up of stakeholders, including CHWs, academic partners, and community partners. And so we do make sure that everything that we're doing is going back to all of our groups so that we can revise, we can assess where we're at, and we can inform the next round of planning. Next slide. And quality improvement is vital. And so, for example, our steering committee takes a survey every summer to assess our processes. So how are things going? Do we feel like we're growing as a committee? Do we feel like we are making progress? How are things, does the process of putting stuff on an agenda make sense to you? All of those different things that can really impact how you function well together. And our steering committee gets those results from that survey and then has the ability to brainstorm about what areas do we see that aren't doing so well and how can we improve upon them. And that allows for a lot of participation, but it also allows for the people who are most impacted by the evaluation results to helping drive the improvement of the processes that you are evaluating. We do mid-year check-ins with all of our groups. So all of our working groups generally have some type of kind of halfway point check-in on how our objectives are going as a whole. And our groups and leaders and participants are always kind of tracking where we're at and revising as needed. And again, flexibility is key, and so we do make change when we need to. Ignoring context for the sake of sticking to the plan is not always helpful, and especially when you're talking about moving targets. So if you're working with participants out in the community, you can't always predict what the community is going to do. And at a similar level, when you're working with people at the policy levels of things, you can't always predict what the policy realm is going to do either. And so being flexible is key. And then I do want to highlight that we just had an article published in the Journal of Ambulatory Care Management about our evaluation process that talks a little bit more about kind of our more in-depth processes, how we evaluate, why we evaluate, what that looks like. And so I would encourage people to check it out if they want to know a little bit more about our in-depth processes for strategic planning and evaluation.
Thank you, Katie, and we'll include the citation for that article when we respond to the questions that people are submitting. Thank you. Paula, I wonder if I can ask you to address the same issues. How did you know that your plan was working or not? And did you use quality improvement processes? Or how did you ensure that your plan was flexible and responsive?
Sure. So we looked at the SMART objectives and we compared them to what the outcomes were, and that was one of our key ways of looking at if things were working or not with us, if the strategic plan was effective, and if the community was learning, if the community was attentive, if the community was responsive and continued to reach out to us and wanted more topics from PASOs. So that was how we knew if this was working or not. Also, a great example I can think of is our radio show. About a year ago, we started our radio novelas, and we've had our Paso a Paso radio show for a while, but this radio novela is relatively new, and in the beginning, we didn't get a lot of responses, and our measure for that was how many people are calling to say, this resonates. I learned something from this specific episode. And when we started seeing that we weren't getting a big response, we said, okay, well, we need to do something a little bit different. We started asking more questions, and we did a little bit more publicity, and then that started working. So that's an example of how we knew our plan was working or not. And also, as I showed earlier, in comparing our objective to the actual outcome, we found that our numbers were projected too high. In some cases, we were pleasantly surprised to see the steep numbers for outcomes, as in our efforts that we had with our resource specialist, the community health worker, with Affordable Care Act, Medicaid, or SNAP. In the case for this great resource outcome, the radio outreach, her home office location, which was at a pediatric center, and statewide mobility were key factors in this achievement. So we started looking more at the radio. We started looking at where our CHWs are located, and also how that expertise can be shared at a statewide level. and the quality improvement process part, we did the monthly reporting feature in our data collection software. And within that data collection software, we also have a portion that's dedicated to supervision. And each supervisor has either a weekly meeting or a monthly meeting, whatever works best for each supervisor and supervisee. And that way they can talk about their quality. They can talk about what's working well, what's not working well, to make sure that our quality is at the highest level. And also regular reporting on program outcomes, sharing information with staff, and making programmatic changes according to data. And that is just better defining our scope of services. And we also have satisfaction surveys for the end of our workshops, and we also have an intern who would dedicate time to calling different participants. And this is kind of funny, but when she would call the participants, she would ask, for instance, how did the workshop go, or did you learn about family planning? How did this go for you? And I said, oh yeah, it was great. And she said, who are you again? And so we said, I guess we need to improve our visibility and our brand recognition. They obviously learned everything that we wanted them to learn in the workshop, but they don't remember who we were. And then that's when we started focusing more on pens with our logo and also being more visible and like I said, the brand recognition. So this quality improvement process leads to other opportunities and improvement. And how did you ensure that your plan was flexible and responsive? The evaluation team we meet to determine if the goals are still relevant or attainable. And we have a vision team, and it's a leadership team within PASOS, and we meet every month to talk about different topics to see how our goals are going, if there's some problem areas. And as I stated before, we have retreats where we revisit if these goals are relevant or attainable. And we update our plan yearly according to the changing landscape. And when I say changing landscape, it could be immigration, it could be things going on with family planning, and emergency issues, as we had here in South Carolina. We had the flood, and this was a great example of flexibility. A couple of weeks ago when this happened, our central staff pretty much dropped everything. I mean, they still continued a lot of their core what they could do, but a lot of it was dedicated to helping and responding to the disaster survivors. And our executive director, Julie Smithwick, based on a lot of the barriers that our Latino families were facing, she opened a GoFundMe, and our goal is $8,000, and right now it's at $4,000, I think 4,300 more or less. And that was a natural response, a great example of flexibility that we have to have in response to the community that we serve. This slide.
Yes, thank you so much, Paula. That's extraordinary. Jeff, can I ask you to put a bow on this for us?
Sure, I'll try. You've just heard examples of sophisticated work in two sophisticated organizations, and I'm mindful that people on the call listening to the webinar are coming from all sorts of different organizations. Some may be just starting up, others are state bureaucracies. So the general principles are applicable anywhere, but if you're just starting up, don't be intimidated, because the core practices and principles are pretty simple. The way to know whether your plan is working or not, no matter what's in your plan, is to have clear objectives. And if you can have those so-called SMART objectives, it makes evaluation much easier all along the way. And then, as you've just heard Katie and Paula say, you have to be collecting some data that is relevant to what those objectives are. And if you have some data system in place, regardless of how sophisticated, you have then the tools to figure out, are we making progress? What is quality improvement? Both Katie and Paula have talked about it. They both clearly use it. It's in the question. It simply means that an organization of whatever type plans, if you look at that blue quadrant of this classic quality improvement cycle, they plan the work that they want to do, plan the intervention that they want to do, go out and do it, implement it, study, and sometimes you'll see check, Plan, Do, Check Act or Plan, Do, Study Act, but these are the classic quality improvement cycle models. You figure out what happened as a result of the intervention. You implemented it, now what happened? And then you act accordingly to achieve your objectives more successfully and make whatever appropriate changes you may want to make. And that often leads into additional planning, new innovation, learning from what your past experience was, and moving the whole thing forward. You can do that on a big level for your overall organization. You can do the same process on very simple things about outreach for meetings. Did we get our outreach done? Did the board members know in advance what the agenda was? No? Well, okay, how do we clean it up next time? Next slide. So communication really becomes key, and this takes us back to where we began. Ultimately, to be successful with this, somebody has to be in charge. I think that was implicit in both of what Katie and Paola described. It's somebody's job to keep track of those objectives. It's somebody's job to collect the data and apply it in a thoughtful way to whether you're achieving the objectives. And then you have to communicate that to everybody who's involved in getting the work of the organization done. Going back again to what Sergio led with, it's a tool. Whoever is keeping track of it needs to dust it off, have it in front. I literally, as an executive director, I knew where my strategic plan was. I had it in a front file folder in my drawer that was most accessible, and I would take it out and look at it. It's a great reminder. Sometimes you take yourself to the woodshed because you're forgetting stuff that was important in the plan. Other times you feel like, hey, this is going great, but use it. Thank you.
Thank you, Jeff. My goodness, I'm almost at a loss for words, and I don't often find myself in that situation. I will say that I am particularly impressed with the content and the quality of this particular session. I found the examples, I found the theories and analogies and metaphors and stories just completely compelling and informative. I will reiterate something that Jeff said about the importance of a strategic plan and the complexity of it at the same time. And I will second his comment about the sophistication and level of detail that our other two panelists have given to the strategic planning in their own organizations. These are extraordinary examples. And please, no matter what point you are in your own strategic planning process, don't be intimidated by it. But please, I hope that you are inspired by hearing that a strategic plan can be such a potentially powerful tool for you. I will tell you that from my own experience in developing strategic plans for my organization, it has not been easy by any means, and it is exhausting at times, but it is always extraordinarily rewarding to have, and has served to anchor me both professionally and personally in many of my endeavors. I do want to take the liberty of reiterating some of the concepts that were presented, specifically about the need for flexibility and the need to be adaptive and responsive. These issues are issues of maturity and sophistication. People who are immature are not flexible and are not adaptive and are not responsive. And so I want to really highlight the level of maturity and humility that it takes to really engage in a process like this and realize, oh my goodness, nobody showed up. What am I doing wrong? To be able to look introspectively and question your own actions and your own objectives and your own processes is really quite a mature approach. And not only is it mature and humble, but I will say that it requires a significant amount of courage to take that posture. And so again, I congratulate our panelists. I want to thank you from the bottom of my heart for giving so much of yourselves to this seminar. I will personally myself have to go home and listen to this webinar a few more times because I really found it to be incredibly rich and deep in content. So again, thank you to all of our participants and specifically to our panelists. I want to make a couple of announcements, very short ones. One is that we will not have a webinar next month out of respect for the people's participation in APHA, which will probably occupy a large amount of people's time. And then it's the holidays. So we will resume our webinar series in January. And if you've signed up with Anita O, then you will receive notice of that. I also want to very, 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 very strongly ask you to respond to the survey that we will send you immediately following this webinar. It is a survey. It's a survey to seek your input about the content of the immediately past this webinar, but also to help us plan for the content of future webinars. I want you to know that the slides and a YouTube link to the recording will be sent to you via email from Anita O. Actually, all of the questions that were asked of the webinar were addressed by the panelists, and so if there's anything that comes up or that questions that you follow up on that we have to respond to, we will. And then lastly, I want you to know that if you want to be added to the mailing list, please email Anita O at the address that you see on your screen right now at Sanofi. And then last of all, I want to just inform everyone that APHA is coming up in 8 days, I believe. Incredible as that might be. It is in Chicago, and if you have not registered, the Community Health Worker movement has a section. We are a formal part of that organization, and we have a full 4-day program set up for November 1st, 2nd, and 3rd. So please join us in Chicago, the Windy City, for the APHA conference this year. So once again, I want to thank everyone. And Anita, you had any closing thoughts?
No, thank you so much. Wonderful session. I really appreciate all the deep comments, really very robust comments, and all of your participants recognizing the information that was provided to you. It's really nice for the panelists since they put so much work into this. So Sergio's great job really conducting this and moderating. So we thank all of you, and look forward to seeing you at APHA meeting and also continuing this in January.
Okay, well, thank you again. And last word, I want to reiterate what all the panelists have said. This is hard work, so keep it fun. Good day, everyone.
This concludes today's conference call. You may now disconnect.